Welcome, everyone, to another episode of Stay Healthy Knoxville. I'm your host, Dr. John Mark Chesney with Simply Physio. Today, I'm excited to be joined by Dr. Josh Manuel with Knoxville Oral and Maxillofacial Surgery. Josh has been with Knoxville Oral and Maxillofacial Surgery since 2019 after completing his oral and maxillofacial surgery residency at the University of Tennessee Medical Branch in Galveston. During his surgical training, he gained extensive experience treating impacted teeth, complex facial infections, facial trauma, benign and malignant tumors, microvascular reconstruction, and nerve repair. He earned his doctorate of dental surgery from the University of Tennessee Health Science Center in Memphis and completed his undergraduate degree in microbiology and business at East Tennessee State University. He's board certified by both the American Board of Oral and Maxillofacial Surgery and the National Dental Board of Anesthesiology. Josh and his wife, Haley, have three children and are East Tennessee natives. So it's great to have him on the show today. So welcome to Stay Healthy Knoxville, Josh.
All right, man. John Mark, I appreciate it. Thank you so much. Thanks for
Yeah,
the invite. Been looking forward to it.
awesome. Well, we love to start off with you taking us back to how it all began and how you really got interested in the dental field.
Sure. So I grew up in East Knoxville. And my wife is from Jefferson County. And so, initially I knew that I wanted to do something between medicine and dentistry. And it was hard for me to initially find which kind of specialty landed for kind of what I was looking for. I'd shadowed multiple practitioners in both medicine and dentistry, and ultimately found once I shadowed an oral surgeon, like, hey, this is a pretty good mix and link up between the hospital, between medicine and dentistry, and kind of serves as a bridge between the specialties. And that's what got me into knowing that I wanted to do oral surgery uh, after that.
Okay. Was that like as you were in dental school or before you got to dental school, you were like, okay, I'm heading this track.
It was before. So initially, when I went into college, like I knew I was in some sort of either pre-med, pre-dental, or even pre-pharmacy route. Like I actually worked at a pharmacy for a few years.
Okay.
My roommate and best friend actually is still a pharmacist in the Knoxville area. And so I knew initially that I was going to go into something like that. A couple of years in, I just kind of had this moment. I was like, okay, maybe pharmacy isn't really where I want to be. And so that's where I kind of went into the dentistry field.
Okay.
Yeah.
And then, like you said, you got to shadow an oral surgeon,
Yeah.
and really were drawn to that field. Tell us a little bit more about what about the field of oral surgery really drew you in or kind of hooked you.
So I think for me, oral surgery, it can be very narrow in scope, but it can also be very broad in scope. So we can manage things from, impacted wisdom teeth to, dental abscesses, infections, all the way into more complex head and neck cancers. And so just having the full scope available is what drew me into oral surgery.
Yeah.
In my residency training, we were able to get good experience in all of those. I think most of us kind of limit our scope now to more office-based procedures, but being able to have the knowledge base and have the surgical skills from residency as far as managing complex patients, both medically and surgically, has been beneficial.
Yeah. So it sounds like during your residency program that you were introduced to quite a bit. So I know I read off the laundry list, a lot of different types
Sure.
of conditions, yeah, from facial trauma to infections, tumors, reconstruction, nerve repair. Was there something in kind of that you were introduced to that you really took more of a liking to, or did you really enjoy just treating just the broad scope of
Yeah,
all that?
sure. No, so I enjoy and still enjoy all aspects. I would say most of what I enjoy now from the hospital side is more along the facial trauma management. And I
Okay.
think it's because it's one, it's a good community service to provide. There's not a lot of us that help to participate in like facial trauma call coverage. But I think it's again, a good service to benefit the community. And also it allows me to still keep those skills that I've learned when I was in residency, right? And it really takes you back when you're doing these complex facial trauma repairs. It really takes you back to the initial like foundations of like anatomy, function, physiology, everything.
Yeah, that moment's notice too, right?
Right, right, exactly. Yeah, yeah, yeah,
Yeah.
yeah.
Um, well, part of your dual certification, or as far as board certified in both, obviously oral maxillofacial surgery, but also dental anesthesiology. So
Mhm.
is that a common pairing, or tell us, our listeners a little bit more
So
how those work together?
sure. So, oral surgeons are unique in the fact that we have both, or I guess, dentistry and medicine training, but specifically in anesthesiology. So, outside of anesthesiologists and CRNAs, we really have the next most experience when it comes to providing anesthesia services. And so, a large portion of our residency is dedicated to anesthesiology, both in like adult and pediatric populations. And so, as an oral surgeon, we provide anesthetic services. And in my office, I sedate patients daily. And part of that training is, of course, knowing how to, most importantly, evaluate these patients, right? Knowing how to mitigate risk and perform anesthesia safely. So, the National Dental Board of Anesthesiology um, came around, and it allowed those who had a special, I guess, desire to say, hey, like I've gone above and beyond the standard and I've taken additional examinations to say that, hey, I am a competent and safe provider of anesthesia. So there's not many of us that go through the extra, I guess, red tape of getting that designation. But to
Right.
me, it was important because it at least shows the patients that, hey, like I'm a competent surgical and anesthesia provider. I'm here to do it safely. I'm here to do it comfortably. And I tell all of my patients, like, we're balancing with anesthesia, we're balancing safety and comfort, right?
Yeah.
But we're always going to err on the side of safety for every patient.
Yeah.
Yeah,
So it sounds like, if I'm hearing you right, that most dentists are able to provide sedation, some form of kind of anesthesiology services, but your further credentialing just allows you to more or less, uh, guarantee is not the right word, but you've gone above and beyond to really
sure.
get that certification. So is that correct?
Yeah, absolutely.
With
And kind of
Yeah.
like with any board certification process, right? So, I mean, it's a process where even for the American Board of Oral and Maxillofacial Surgery, we take a written exam, and that will initially, after the written exam, you have to pass that portion, and
Yeah.
then you are invited to sit for the oral certifying examination, which is where at the time I traveled to Raleigh, and we go through a gamut of cases that can be from simple, what we call deno-alveolar, which is extraction of teeth, dental implant placement, all the way to pathology, reconstruction, TMJ management.
Yeah. Okay. Awesome. So it sounds similar in, like, I guess, a lot of health fields. Like in physical therapy, I have my CBNT, which is certified dry needling therapist. Um, but that's an extra certification that kind of more or less, tells the public that I've gone above and beyond and kind of the state requirements to be able to offer it. Because any
Sure.
therapist that's kind of met the baseline requirements is able to do it. But most of them don't have that certification behind their name.
Right, right,
Yeah.
right. Exactly.
Yeah. Well, perfect. Well, want to talk a little bit about just an oral surgeon. And here for our listeners, I think probably what first comes to mind, and probably even for myself for a long time, is you think wisdom teeth. It's like, oh, an oral surgeon, they take out your wisdom teeth, right?
Right, right.
Something on those lines. So maybe help our listeners understand. Kind of just how broad your specialty is.
Sure.
And I know there's a lot of things that you do, but even just in the field, are there other aspects that are generally offered as far as the skills of an oral surgeon?
Right. So, all oral surgeons have received training in various aspects of oral maxillofacial surgery. And that really can include surgery from the clavicles and up, right? So, as a private practice oral surgeon, yes, like you said, most of the time we see impacted wisdom teeth. So, a large majority of our surgical cases are management of those impacted wisdom teeth, right? But we also will take care of pathology. That could be, soft tissue and hard tissue of the face, mouth, and neck. We also can treat disorders of the temporomandibular joint. We do orthognathic surgery, which is corrective, like jaw surgery if someone has an underbite or overbite. We do, some of us will do cosmetics type surgery. Some will do reconstructive. There's fellowships that are available in head and neck surgery. There's fellowships available in cleft and craniofacial surgery. So, talking about cleft lips, cleft palates, and like craniofacial anomalies, things like that. So, it is a very broad scope that's out there. And there is a lot of overlap between ourselves, ENT, and then, of
Hmm.
course, plastic and reconstructive surgery. And it really depends on where you train. So, like where I trained, we had a very strong ENT and plastics programs. And so a lot of the facial trauma, we all kind of split up, right? Our trauma call was split like every third day with the ENT and plastics guys. But here in Knoxville, there's no, residency associated with the University of Tennessee Medical Center. So a lot of the residents get training extensively in things that you would expect a ENT or plastic surgeon to manage. So
Okay.
again, it's a lot of overlap, and I think it
Yeah.
ultimately comes down to we all get a lot of training, and when people get out of residency, you'll find that a lot of oral surgeons end up doing extractions and like wisdom teeth and implants, right? That's kind of
Yeah.
like their bread and butter. Same thing with ear, nose, and throat doctors. A lot of like bread and butter cases that you'll see them doing are, tonsils, tonsils, adenoids, things like that. And then the plastics guys, a lot of times will do like breast and body cosmetic procedures.
Okay. Um, yeah, there's a lot of overlap, too, with I guess other fields, any kind of medicine field, whether it be like a neurosurgeon, spine surgeon, or you have an orthopedic, spine
Yeah.
surgeon. How would you describe, because there's a lot of subspecialties, and it's hard for me to, even though I have a number of dentists in my family, but it's hard for me to understand some of the differences, such as like a periodontist or a prosthodontist, oral surgeon. Are there kind of overlaps in some of those fields too with oral surgery, or not as
Yeah,
much?
so dental specialties, they now have a dental anesthesiology program, right? They have endodontics, which is a root canal specialist. They have a
Yeah.
periodontist who is a specialist in management of like diseases of the gums and surrounding tissues. Orthodontists, of course, work with now they're dentofacial orthopedists, is I think one thing that they
Okay, that's a
say,
new
right?
term.
So
Okay.
yeah, so more involved. It's more than just like straightening teeth from a cosmetic standpoint. They're really
Right.
looking at like airway and like functional concerns due to someone's either skeletal or dental abnormalities,
Sure.
right? Um, and so, like you said, there is a lot of overlap. A prosthodontist is someone who specializes in like more complex procedures inside of dentistry. So, patients who have collapsed, what we call like a collapsed bite, where they've lost several teeth, and as a result, they've lost the space that was previously there. So, those can be complex patients to manage. And so a prosthodontist is someone who's had extra training in management of those complex scenarios.
Awesome.
For us,
Thanks.
I would say most of the overlap for us is coming mostly with the periodontist. Um,
Okay.
I had a periodontist here in Knoxville. His name is Matt Heaton, and what he
Yeah.
described
I
to
know
me,
Matt.
yeah, the best
Yeah.
way that he described it to me was that, hey, like as periodontists, we focus on like the microsurgical portion of the mouth and the teeth and the gums, whereas the oral surgeons focus on the macro structures, like when we're talking about like jaw surgeries and things like that. So I thought that was like we have a lot of overlap, right? We
Yeah.
both do dental implant treatments. But that was a good way of kind of knowing the difference between the two.
Yeah, the differentiation. So
Yeah.
help our listeners then, since I mean this is a Knoxville oriented podcast, so that people can connect with you. What does a normal, I don't know, day or week look like? What kind of things are you regularly doing and helping people with?
Yeah. So again, most of our procedures we're able to do in office.
Okay.
Okay. So that, of course, that's convenient for the patients because they're not having to go to, a surgery center or a hospital. So it's a familiar place that they can come to, very similar to how a dental office would run, right?
Yeah.
And so we do a mixture of surgeries and consults. Most of our surgeries we try to do in the morning because, of course, if we're performing sedation services for patients, NPO guidelines and protocols are a lot easier and more cut and dry when you have morning surgeries versus afternoon. And so my day typically looks like surgeries in the morning, and then we'll have a short lunch break, and then we'll do all of our consultations in the afternoon.
Yeah.
And again, day to day, it can be in the office, it can be wisdom teeth procedures, dental implants, pathology like cysts and tumors. It can include TMJ management. TMJ management can be surgical, it can be non surgical, it can mean Botox. So that's a lot of the treatment that we do day to day.
Okay. Is there any part of that that you maybe just enjoy a little bit more? I mean, not
So
to say you have
I
favorites, but do you have
honestly,
favorites?
so I think for me personally, my favorite, I guess, especially when the oral surgery is probably management pathology. Honestly, I
Okay.
think pathology is very unique. I think because you see cysts and tumors that can arise from the teeth, it can arise from the soft tissue, it can arise from the bone, it can arise from salivary gland tissue, right? So there's just it's always unique in presentation, and I think it presents some unique challenges in management. And for me, I really enjoy the pathology cases.
Okay. Awesome.
Yeah.
Well, with let me see here. So maybe briefly talk about, wisdom teeth. Are there any misconceptions about wisdom teeth?
So wisdom teeth. So we try to look at this objectively. I try to do everything as evidence based as possible, right?
Yeah.
And typically it was like, hey, you have wisdom teeth, they need to be removed, right? Well, then they're like, well, maybe you don't necessarily need to remove your wisdom teeth, right? Unless they're causing issues, right? But with wisdom teeth, I found personally that at some point in one's life, more likely than not, you're going to have those wisdom teeth removed. And I read that there's about a 3% risk per year that you see that.
Mm.
And in younger populations, specifically around ages 15 to 18, right, we know that healing capacity, regenerative capacity in those patient populations is much better than patients in their 40s. We know that just total cost of treatment, morbidity associated with wisdom teeth procedures is much better in someone who's 15 to 18 years old. So
Yeah.
by and large, when I'm referred, for a wisdom teeth evaluation, unless there's complicating factors outside of it, more often than not, those patients are going to leave with an appointment to have those removed.
Yeah.
Yeah.
And it sounds like you're saying that kind of 15 to 18, kind of high school age is a good time to consider that.
Right, right.
Yeah.
And, we perform those again in office under deep sedation, general anesthesia. We do that very safely. Um, as far as things that have changed in recent years, so the way wisdom teeth have been removed have been largely the same for 50 or more years, right?
Mm.
But recently, within the last 10 years or so, we've been using Exparel to help with kind of postoperative pain management. So that's a liposomal bupivacaine. Okay, so it's an anesthetic. It's a long-acting local anesthetic that we've been using for years, but it's been reformulated into an extended release. And so we inject that at the end of the procedure. It slowly releases anesthetic over a 3 to 4 day period of time. And we've seen that it significantly reduces the burden of opioid use. So that's one thing that we like to use and offer to patients. Something else that we offer is PRF, which is platelet-rich fibrin, right? So that has a lot of uses I've had patients use it in like musculoskeletal regions, right, and hamstrings. I've had patients use it from like a cosmetic standpoint. And so for us, we
Is
use
PR,
it.
PRF, you said?
Yeah,
Plate?
yeah,
Okay.
platelet rich fibrin. So what we do
Okay.
is we will obtain a sample of blood and we spin that down in a centrifuge, and it will basically concentrate those growth factors at this top layer. And we separate that from the underlying clot, and we place that specifically into the lower third molar extraction sites. And studies show that it significantly reduces the rate of dry socket, infection, just kind of helps speed up that healing process.
Is that different? So I've heard of PRP with for musculoskeletal kind of healing pieces to help with maybe laxity or
Right,
is
right.
that similar or
So it's similar. It's a different spin protocol
yeah, okay.
that you see, but they are similar, just kind of nuanced differences between
Yeah.
them. Yeah,
Okay. Well, nice. And then so you do quite a bit of implants too, you
yeah,
said.
yep,
So
yep.
what would kind of the general public need to know about like what makes a good candidate for an implant? How
Yeah,
successful are they? Those some of those
yeah,
questions.
yeah. So dental implant success rate, I mean, is greater than 95% in most patient populations, right? Of course, patients who are smokers or patients who have immune diseases or poorly controlled diabetics, basically anything that can alter wound healing, those patients are have, I would say, a lower success rate with implants, but we've successfully placed implants in those patient populations before. But those are things to consider where you may be at high risk of having an implant not heal correctly.
Okay. Um,
And for me, if you have a missing tooth, um, and specifically looking to replace that missing tooth, an implant looks, feels, and functions most like a natural tooth. There's other options that are out there. There's dental bridges, there's removable prosthetics, but from a day-to-day convenience and function, I think an implant's the gold standard from that standpoint. And they come in a variety of materials. Most of them are titanium alloys, but we fully recognize that there are patients out there that either have adverse, allergies or just aversion to metal-based products. So now
mhm.
we do offer ceramic or zirconia implants for those patient populations.
So those can you really tell that it's a fake tooth
Most of the time, you
then?
can't. It can be very tricky, especially in what we call the anterior zone, like in the smile line.
Yeah.
Because everyone's gingival tissue is different. Some patients have a thick biotype, some have thin, some have a high smile line, some have a low. So it can be very tricky, especially in the anterior region.
Okay. Um, and then, coming to an oral surgeon for an implant, yeah, a lot of dentists do implants too. Are you doing more complicated implants or
Yeah,
how does that
yeah,
all
yeah.
work?
So and that's something that definitely over the last several years, there's just been, I think, more training in the dental school environment.
Yeah.
And there's been more access to continuing education for dentists. And I think it's a great service to provide, right? I mean, anything that you can, most patients, they see us once, right? Maybe a handful of times. You've seen
Yeah.
your general dentist regularly. You've fostered this relationship with them. They're comfortable with their dentist. So any treatment that a dentist feels confident that they can provide, I'm more than happy to support them in that, right?
Yeah.
And we know that there's a lot of missing teeth out there, right?
Hmm.
And there's plenty of implants to be placed.
Needed.
And
Yeah.
so, yeah, and so I think having a general dentist having the opportunity to replace that missing tooth with the patient in their office is a great thing. And
Yeah.
so, yes, what that, like you said, what that does end up doing for us, we see more complex cases. It could be patients who need sinus augmentation, which basically means the sinus is an air-filled cavity on either side of the nose, and you can't place implants directly into the sinus because that could cause issues. So we do what we call a sinus augmentation procedure, where we gently reflect or lift up the membrane inside the sinus. We place bone underneath that so that we can then place the implant. So that's one reason you may see an oral surgeon, or if you have a significant amount of bone loss in the area that needs to be reconstructed, a general dentist may refer you to an oral surgeon to have bone grafting performed for dental implant placement.
Awesome. Well, you touched on the topic about, patients' comfort level or nervousness, and you always kind of hear that, a lot of people hate going to the dentist, or
Sure.
just don't like it, and how you kind of have to overcome that, and plus a surgeon in your name, which people don't want to have surgery if they don't need to have surgery,
Right.
and that you haven't, you don't have maybe a long history with them. How do you help people feel comfortable?
You don't get much time, right? So this is
Yeah.
really where first impressions make a huge difference, right? And so I go into every consult already knowing that most likely than not, the patients aren't excited to be here to see me. Okay, right? I understand that. I fully understand that,
Yeah.
and acknowledge that. And I know that I have to, one, exude confidence. I have to show that I'm confident in the procedure that I can provide for them. I have to show that I'm compassionate, right? So I have a very limited amount of time because they're entrusting me with their care, right?
Yeah.
And that could be
Yeah.
from a local anesthesia standpoint, or that could be from uh, an IV sedation, general anesthesia standpoint, right? So it can be tricky, and with any patient, like there's some patients that I feel like I'm a pretty easy person to talk to, right? I try to pick up on patients' personalities as soon as I walk into the room and say, okay, is this someone that I need to throw more humor into the conversation? Is this someone I need to
Hmm.
be more straight laced and show more like evidence based type conversation with this patient? And so I feel like I've gotten good at being able to figure that out on the fly. There's still some patients that will be kind of curveballs for me,
Yeah. Always.
but otherwise, yeah. I mean, that's the most important thing. Is just making sure that you can, be confident and compassionate with these patients.
Yeah, and I'm sure even kind of going back to the board certified in anesthesia, like having some of those extra things just to reassure, like to
Sure.
overcome maybe a gap, if you will, of not having that long history relationship, that you have to try to bridge that gap pretty quickly.
Right.
Yeah, it makes sense to be able to offer those like extra certifications, if you will, and training, to obviously to put the money where the mouth is, and really let them know that, hey, you're going to be in good hands.
Right. Absolutely. And for me, like in this day and age, especially when we look at things from a digital standpoint, I mean, reviews are huge
Hmm.
for really any business, right? Whether you're in healthcare, whether you're in the food industry,
Yeah,
even for me, anytime I'm going somewhere, right, I'm gonna get on Google
see
and
what.
like, hey, what are these?
Yeah,
How do these reviews look, right? And
yeah,
I'm not just gonna look at the star rating. I'm gonna say, let me actually read these and kind of see what's going on, right? So
yeah,
that's why for me, like the biggest compliment that I can get from patients is just a positive review that they leave
yeah.
for us, because that's going to give other patients just more confidence in our practice and in our office.
Yeah, that's a good tip too. I mean, just for our listeners, is a lot of people may not think about looking for reviews for a health provider.
Mm,
You think about obviously with products, Amazon reviews, and a restaurant type of thing. But like you said, those are organic thoughts and opinions, and experiences, right,
right,
from the public. So yeah, good tip there. Well. The other, part I want to touch on, and I'm sure we could record a full podcast on TMD, or
right,
TMJ pain. Let's have, for our listeners, that's where we got really introduced. We had a few connections. So Josh was in school with my brother. I think you guys overlapped a little bit. I can't remember how we actually got introduced, but maybe we just kind of made some connections. I think it was more the TMJ stuff, but had some other connections by that. But obviously we work together with many cases. So I wanted to touch base a little bit with our listeners on some TMD or TMJ care, and how an oral surgeon, would help with something like, or how you do, considering that you're one of the few, if not, I mean, there's a few other kind of oral surgeons may do a little bit of TMJ stuff, but
Mhm.
I think I'm fair in saying that you've made a name for yourself, at least in our area, of wanting to help more of those patients than others who try to do other things besides TMJ care as far as oral
Right.
surgeons. Is that
Right.
fair to say?
Yeah. Yeah.
Yeah,
Absolutely. Yeah.
yeah, that's what I
Absolutely.
tell the people is like you gotta if you need advanced TMJ care beyond what we can offer, you need to go see Dr. Manuel. He can he helps in those fields. So I know I'm talking here on an issue about TMD, but tell us a little bit about what you do for somebody suffering from TMJ pain.
Yeah. So for us, it's really kind of coming up with a diagnosis. Is this um, truly joint driven? Like, is this an intra-articular problem, right? So we talk about the temporomandibular joint, that includes the actual structure itself that has with it the articular disc. And that disc position a lot of times will dictate patient symptoms. And so patients who have joint noises, they could be painful or they could be painless. That's just a dysfunction with the joint itself. And we also have the surrounding ligaments and muscles. And some patients have clenching, grinding, or just based on their own anatomy, they may have thicker masseter muscles surrounding their lower jaw, and that can put more contraction and force on the joint. So it's really trying to diagnose, okay, am I treating a true joint pathology or dysfunction, or is this more of a myogenous or muscle inflammatory component? Because if someone comes in and you diagnose them as joint and there's a muscle component to it, but you aim
Sure.
your treatments at treating the muscle alone, they may not have significant improvement, right? Or vice versa, right? They have a joint issue, and you treat them for muscle pain, right? So most of that, when it comes to joint related, like mechanical issues with the joint, we can do an arthrocentesis procedure. So an arthrocentesis procedure is a lysis and lavage of the temporomandibular joint space. And in that procedure, we do it in the office, again, under, moderate to deep sedation or general anesthesia. And what we do is we place a needle into the most posterior aspect or recess of that joint. We inject fluid, initially local anesthetic that will distend the joint space. And that can help increase the hydraulic pressure within the joint, which will help break up smaller adhesions that could have formed, that could have caused that disc to get into an abnormal position. And once I do that, I will then take another secondary needle and place it into the most anterior portion of the joint and make a circuit, right? So I'm able to have an inflow and outflow tract. And when we do that, we can kind of decompress the joint. We can flush out all the inflammatory mediators that may have built up from chronic inflammation. We can break up adhesions within the joint by flushing it out as well. And then lastly, we will inject PRF, again, which is the platelet-rich fibrin. And that has been shown in literature to help support just local repair, whether it's disc repair, cartilage repair, bone repair in the immediate region. And a lot of times we'll inject that as I'm injecting into the joint, as I'm retracting that needle, I'll actually inject some of that in what we call like the pericapsular area, where you'll have more of your muscles and ligaments and other structures.
Yeah. What kind of patient would you say kind of the history of that patient would fit potentially like an arthrocentesis that you're thinking, okay, I think this patient's gonna would really benefit from something like that?
Sure. So for me, I tell patients my goal with an arthrocentesis is to, one, reduce their pain, increase their range of motion, and then lastly, reduce locking symptoms. So a lot of times patients will have what we call a TMJ closed lock, right? That's where they feel like they can't open their mouth fully, or sometimes they can't bite down. And in those patients, that can happen frequently. I've had some patients where it happens daily, and in other patients, it can be very infrequent. But for patients who have reproducible pain at the level of the TMJ, have locking symptoms, and decreased range of motion, I have full confidence that an arthrocentesis procedure would be successful in those patients. And usually in literature, it's quoted to be, greater than 90% success rate in those patients.
Yeah. How how is that maintained over time? Like, are there other kind of things that might have brought them into like having that in the first place that also needs to be identified or considered? Or do you
Yeah.
find that a lot of people that it more or less it solves it?
So it can be due to what we call occlusal imbalances or occlusal instability. So based on someone's bite, right? Someone could have a skeletal issue that they could have had orthodontics for, and they corrected the dental relationship, but the skeletal relationship is still abnormal, which is causing joint related pain, right? It could be patients have a clenching, grinding habit. So it could be acquired or it could be something that was developmental. And so if you're able to kind of diagnose those either extrinsic or intrinsic factors that are causing those issues, of course, that will play into the long-term outcomes of the
Yeah.
procedure. And so in some patients, you can do an arthrocentesis procedure, and if the disc has any adhesions, you can break those adhesions, and the disc has a better resting position. Um, then, of course, the mechanics of the joint you would expect to improve or stay where they should be. But if they have some sort of either habit or some sort of instability in their bite, then of course you can have a recurrence of those symptoms.
Gotcha. Now there are other procedures that oral surgeons can do, like more on the surgical route
Mhm.
for TMJ. When when would that be necessary, and how? And are there other things that you provide as far as other procedures or surgical procedures for TMJ?
Sure. So, what I tell patients, what I love about an arthrocentesis is that it's a very low risk but potentially high reward procedure.
Yep.
There's no incisions. There's very low risk of infection. It's a very minimal recovery procedure, minimal downtime.
Hmm.
But you have a potentially high reward, meaning that your pain has been significantly improved, your range of motion has been significantly improved, as well as your locking symptoms. In some patients who fail to respond appropriately to an arthrocentesis, this is when we make consideration for more advanced surgical procedures that could include disc repositioning procedures, where we either through an arthroscope, so either arthroscopically or through an open procedure where we physically anchor the disc down. Other procedures is a discectomy procedure where we will physically manipulate the disc and remove it in its entirety. And then beyond that, you start getting into more total joint replacement. And that's usually more end stage temporal mandibular joint dysfunction or patients who have had, either masses, pathology in the joint, or other conditions requiring a
Yep.
total joint.
Yeah. And so, like you said, there's obviously strong reasons to start conservative, right? With these other procedures that you've, mentioned. One is what percentage of patients really would require or need one of those surgical procedures that, you mentioned? And are those things that you also do?
Yeah, so it's been pretty well established in literature, and then also I believe in my own practice is parallels this. I'd say about 5% of the TMD patients that I see will go on to need a surgical procedure like that. Those are procedures that I do offer myself. Um, Most commonly, I would say after the arthrocentesis procedure is a discectomy procedure where we remove the disc and we'll do an autologous fat graft from the umbilical region that we'll put in lieu of the disc in the joint space. And over time, just due to like the functional matrix theory, you'll form a pseudo disc in
Hmm.
that area once the native disc or disease disc has been removed.
Hmm. Interesting.
Mhm.
Well, like you said, I know we could go on quite a bit as far as discussion points on TMD, but maybe that's for another episode that we
It
could
can be,
reset.
and I think one thing that I would like to end on as far as the
Yeah.
TMD, I feel like a lot of patients they downplay the role and have low expectations for conservative treatment. And I think it's because conservative treatment that they've received in the past was not necessarily sound, kind of logical, evidence based treatment. I think
Yeah.
now, especially with you, what you're doing at Simply Physio, where we have true targeted TMD intervention, I've seen just a significant improvement in patients who initially were said that they didn't want conservative treatment, they thought they needed surgery, but maybe had interventions that weren't really aimed and targeted for TMD.
Yeah.
Same thing when we talk about from a general dentist perspective and occlusal appliance therapy. They may say, "Hey, I tried an over-the-counter night guard," or "I know
Hmm.
Amazon. I've tried these night guards; they haven't worked." And it makes sense because it's just those appliances aren't made to specifically treat a TMJ dysfunction. And
Yeah.
so I think when we have a full treatment team, and that's what I've even told my own patients, I've had successes by myself without any physical therapy intervention, without any occlusal appliance therapy. But I can tell you without reservation that my outcomes are so much better when I have a full treatment team where the patients are receiving physical therapy intervention, they're receiving occlusal appliance therapy, and
Yeah.
they have an arthrocentesis or TMJ surgical procedure. Outcomes are much improved.
Yeah. Well, that's great. Thank you for sharing too. And, ultimately connecting, us connecting, but also with other health providers, like really for any condition, kind of recognizing that oftentimes for maybe complicated conditions or a condition that is just complicated, usually, takes a village, right?
Absolutely.
And that people have hope that just because it's complicated doesn't mean that you're destined for, a more involved and risky procedure. That oftentimes is the combination of a few skilled providers, like you said, to team together. And when that happens in a really cohesive way, that there's a lot of good that can be done in helping people avoid from needing to have, a more, risky or permanent potential intervention.
Sure.
So, well, thank you for the shout out there. Appreciate it.
Yeah. Yeah.
but
Absolutely. Absolutely.
it's good. Connecting with you too. I know here really, I guess I don't know the past 2 years or so of likewise we do a lot of TMD and we help a whole lot of people, but there's some cases that we need extra help with, and we need to refer and collaborate. And so it's nice having also a trusted oral surgeon in town that they don't have to go to Maryland or Kentucky, these other places
Right.
where oftentimes they were going beforehand. So yeah.
Sure.
Um, well, the kind of last topic here is I know you do a lot of teaching, education, training residents. So maybe touch on that as we wrap up here the episode on why that's important and how you help
Yeah.
out with training up kind of the next wave of oral surgeons and kind of what you do on that aspect.
Yeah. So I'm on staff at University of Tennessee Medical Center as well as Dolly Parton Children's Hospital. And part of my staff privileges at University of Tennessee Medical Center is that I get to work with the residents, right? And so these residents are typically there's an oral surgery program can be 4 to 6 years in length, depending on if you go for the MD route, which is where you would go through medical school and be awarded a doctorate of medicine. So I'm with these um, residents for 4 to 6 years, and most of the time I'm helping them in management of facial trauma. But then I also do lectures as well. So I lecture with them frequently. It could be on medicine topics, it could be on oral surgery topics. Last week I did one on careers in oral surgery, right?
Mm.
Whether it's I'm a private practice owner or I'm part of a dental support organization, or I'm in academics. So giving lectures to them. And I think it's important for me, looking back to my residency training, I had the mentors that I had that, kind of poured into me the type of surgeon that I want to see myself. I want to be a compassionate surgeon, but I want to be a very skilled surgeon, right? And so being able to work with the residents and kind of help train them, especially in like evidence-based principles, is an important reason of why I continue to stay on at the University of Tennessee Medical Center. I think it's important from a resident education standpoint that they have um, multiple, I would say, from that standpoint, they have other attendings that they have that may have had training elsewhere. So I think if they have multiple abilities to get information and extract information from an attending who trained uh, at the University of Florida versus someone who trained at the University of Texas, I think
Hmm.
there's some nuances in treatment that they can gain from having experiences with all of those surgeons versus just, hey, I trained at the same program here. This is how we did it. This is how we've always done it. But why do we do it that way? That's just how I was taught, right? So at least they get different perspectives. They get different
Yeah.
perspectives of treatment. Yeah.
Awesome. And I know it's always, we take a lot of students too, but fun. It's definitely perspective because it takes you back to, like you say, when you were in their shoes, and
Hmm.
how everything comes at you so fast when you're kind of doing things for the first time. But it can, with experience and with the right training and support, things start slowing down a little bit, and you can think more critically and really make good decisions, with when that comes about with good training. So,
Right.
um, well, cool. Well, I always like to wrap up the episode with a few questions just to inspire our listeners to explore our surroundings. The first one is, do you have a favorite local restaurant around Knoxville?
Absolutely. So I would say my favorite local restaurant would be Vita.
Okay.
Yeah. Yeah. I
And where's
really
that at?
enjoy. So it's off of Gay Street there, right outside of Market Square.
Okay.
And so yeah, it's right off of Gay Street.
What kind
So
of restaurant is it?
fantastic. So it's considered a Pan-Latin restaurant with like an Asian
Okay.
flair.
Okay.
But what's so unique about it, like I've always gone to restaurants where it's like you had like an appetizer, you had a main course and potential for dessert.
Hmm.
What I love about Vita is that it's just, for me, I go for the experience now, right?
Uh-huh.
And of course, Vita has the Vault, which is like a cocktail, like only a little bar that, makes specialized drinks, right? Just a very great atmosphere there. But in the actual restaurant of Vita, um, it's the experiences is more small plates. So you can order small plates of all these different types of foods, and they usually will come in waves. So it's not like it's all like, here's your salad, here's your entree, now it's time for dessert. So they kind of come in waves as they prepare them from the kitchen.
Okay.
And it's a very unique experience, very good food for
Nice.
sure.
Like tapas? Is it more tapas style? Kind of small
Yeah,
plates?
yeah,
Okay.
yeah, yeah,
A little bit.
yeah,
Yeah, the
yeah,
shareable stuff.
yeah, exactly.
Right.
Yeah,
Nice.
yeah.
Yeah. All right. Next question. What's your favorite thing to do outdoors around Knoxville, greater Knoxville area, East Tennessee?
For, yeah, for me, having my three kids, Emery, Nora, and Graham, ages 12, 8, and 6. For me, I feel like it's their prime childhood, right? And
Uh,
so for me, I try to do anything I can to protect my time with them and take them out and do things outside of the house or,
yeah.
one, I mean, I will always love Dollywood. Like Dollywood just has a special place. Like I just absolutely love everything about Dollywood. But for us, like, I mean, we're so fortunate to be at the like foothills of the Great Smoky Mountains National Park.
Yeah.
I think it's one of those things like you live so close by, you take it for granted.
Hmm.
But it's like the most visited national park. People driving from all over, like even international travel to see the Great Smoky Mountains National Park. So I try to get my kids like outdoors, like not for this past Father's Day, but last year. we went to Klingman's Dome, which has been
Okay.
renamed
Oh,
to
that's right.
Kauai. Yeah, it's been
Yeah.
renamed. But I took the kids up there. I was like, that's the only thing I want to do for Father's Day, right? I want to
Yeah.
show you guys
Awesome.
Klingman's Dome and go up to the observation tower.
Yeah.
And we go up there and a storm blows in. So this is like pouring down rain on us, and it was an experience. It wasn't the experience I was
Memorable.
anticipating, but it was a memorable experience for sure. Yeah, I'm
Nice.
all about making core memories with the family.
Yeah. Well, what's your next core memory? That's kind of my next question is, do you have like a bucket list thing that like, oh man, I've been meaning to go out and do this or experience this. This is something I want to go try.
So speaking from like the outdoor standpoint, for me, I've never been to Canada, but I've just seen so many like videos, images, especially like of the Banff area.
Yeah.
And I
I've
think
heard great things.
for me, like I think that's the next trip I want to take with the kids.
Yeah.
They're kids, they enjoy going to a beach and that's great, but I also want them to see other types of landscape and
Yeah.
enjoy things a little bit differently. So that would probably be like my item that I would want to do next for
Yeah.
sure.
I did. I had a patient just a few weeks ago said that, and her kids are older now out of the house, but she said they took a trip to Banff, and she was saying that that was when they reflected back. She asked them recently, and they said that that was the most memorable trip was to Banff.
Yeah, yeah,
Yeah.
absolutely.
So I was looking at it, I was Googling a little bit. I was like, maybe I need to get over there and try out Banff.
Yeah,
So,
I mean that's what we were doing. Like even for our kids, like they're kids still. It's important like that they get toys and things like that, right? Or you know, but we're more on like experiences now. So like
hmm
we got tickets to like the Savannah Bananas, right? So we went to
yeah.
Banana Ball at
Okay.
noon.
Uh-huh.
Um, we are going to a Forrest Frank concert in Louisville, Kentucky in the next couple of
Okay.
weeks, right?
Nice.
We took a small trip to Atlanta to go to the aquarium and World of Coca-Cola. So I've just found that like experiences like that, just like you said, like
Yeah.
making these like core memories versus like what did I get for my birthday last year? They probably couldn't tell me, but they
Yeah.
could tell me memorable things about the trips that we've had.
Yeah. Well, awesome. Well, the last question I ask, and feel free to take it kind of like the dental, oral health arena, but what would be your best tip for staying healthy?
Best tip for staying healthy. You know, from like an like oral
Yeah.
surgery standpoint,
Yeah.
yeah, I would say most important thing I feel like is just like in general is just trying to reduce like sugar consumption, you know. Just in general, I think there's a lot of positive impacts from a systemic health standpoint.
Yeah.
And then of course, sugar is a primary driver and source of how you get, dental caries and decay and things like that. So I think that would probably be my number one tip is just
Yeah.
not saying eliminate it, right? I mean, everyone loves,
Right.
sugar, but I think trying to limit consumption, I think that would
Moderation.
be, yeah, absolutely.
Yeah. Watch
Absolutely.
the sweet tea, right?
Yeah, exactly.
Especially swishing that around your mouth all day.
Yeah, yeah.
Oh, cool, man. Well, thanks for so much for coming on the show. It's always a pleasure to do these two because I get to know people that I've known for a little bit, but not in this way of the back history and hopefully sharing that with our listeners and the people that are maybe needed an oral surgeon or who been a bit nervous about know they need some dental care that requires somebody with your expertise. So yeah, hopefully this will help them to connect with you kind of through this medium um, and to know that you can help. And thank you for serving our community in ways that are really needed too. So I know your work is serving many people.
Yeah, well, I appreciate it. Yeah, happy to help. Happy to help.
Cool, man. Well, it's been a pleasure, and stay healthy, Knoxville.
All right, sounds good. Take care.
All right.